her public input.
Yep, I got that message from Maya, but I wanted to ask first, Ben, if there was any of your staff wish to sort of go through anything that's been you want to end up adding before I go to Salah.
No, I think the presentation was the key points, and then we're happy to take any questions.
Ka pai. So we will go back to the public input, and Salah, tēnā koe, e te rangatira, nau mai hare mai, ngā mihi ki a koe mō tō mahi. And Salah, I just wanted to acknowledge you and say thank you so much for the work. I'm unsure if you heard the full presentation, but without you, we would not have got the mahi that the Kaunihera are doing out to many of our community. So from us at the Kaunihera, the council, is to say thank you so much. And look, I invite you to sort of come online and just give us just your view around the mahi that has been done. Kia ora.
Tēnā koe, Councillor Filipaina, and thank you all members of the council. Hopefully you can hear me well. My apologies, I have not used Skype for quite some time, even though we Zoom every single day, so my apologies for my lateness. It is my honour and privilege to be here as the CEO of Hāpai Te Hauora, an iwi and mana whenua and Mata Waka owned organisation that focuses on reducing inequities for Māori, but more importantly, all communities that are in need. So it is my privilege and honour to be a part of a partnership approach that we have taken with Auckland Council. I really want to acknowledge, first and foremost, our ownership, Te Runanga o Ngāti Whātua, Tainui, and also Te Whānau Waipareira, and the huge efforts right now that they are contributing to the COVID-19 response. And so I want to mihi to them outside of any, we're in a global pandemic, and everything that we can do to contribute to that, I think, is outstanding. And so I mihi to my ownership and to all of those and many of you online that will be contributing to supporting our nation get through this pandemic. Specifically around this kaupapa, I would like to pay a huge amount of respect to Auckland Council. This is, as I have a national landscape, we are contracted by the Ministry of Health to hold an oversight across all advocacy components of the tobacco control sector. And from a national perspective, Auckland Council is one of the very few that I can see are taking a leadership stance and adopting and actually being proactive in their approaches to achieving a smoke-free Aotearoa by 2025. So I truly commend the work that has come before this initiative was even started, and for its continuation through some really tough times. I think that is critical, whilst we understand the importance of this global pandemic, that we also understand the epidemics of non-communicable disease that our whānau experience, and smoking is absolutely one of those, especially for our priority population. So I'm mihi to Auckland Council and to the councillors and to all those that have contributed to this piece of work. I think it's really important that we also acknowledge all of those whānau that are impacted by the harms associated with smoking, and obviously at the forefront of those bad statistics are Māori and Pacific communities. And so we have to take innovative action. We have to be brave and bold in order to get an equitable outcome with regards to smoking prevalence reduction. I want to mihi to the way in which this partnership has been facilitated. I think that it demonstrates a true trusting relationship that allows two organisations to come together for a common purpose and goal, but actually more importantly, placing the importance on our communities and letting them drive that change, allowing them to be enabled the opportunity to provide their own solutions and finding their own way to well-being. So thank you very much for the approach that we've taken. I want to also really mihi to both Rebecca and Tara for their amazing, outstanding community leadership. And whilst they may think that Hāpai have done a lot of that work, actually it also lands back on those two individuals and the other supporters within that team who have made this work possible. I really want to also speak really briefly around our connectivity from an kaupapa Māori organisation's perspective, but also our broader reach. So I've already spoken about the position in which we hold from a national perspective in tobacco control advocacy, but also we have really extensive networks across the DHB and health system in general. We have very strong relationships with the stop smoking services that are existent in this region, and also our sister service Tala Pacifica, who have been integral in reaching those specific communities. So I want to mihi to all of our partnerships that have made this partnership between Auckland Council and Hāpai Te Hauora really flourish. And I think at the bottom of it, we all have the same common purpose and goal, and that is to have flourishing, thriving whānau, specifically our Māori and Pacific communities. I think one of the things I really want to pick up on is the proactive stance that Auckland Council has taken in regards to some of the harm reduction approaches that are needed in order to level or enable us to level out the inequities that currently exist from tobacco-related harm. And so I really mihi to the collaboration that has been participated with the Health Promotion Agency, Te Herenga Hauora, with their Vape to Quit program, and also looking at other innovative ways to get our whānau more closely to reducing their tobacco harm. I think I'll pause there, but I thank you again for your time to hear me, to allow me to contribute to this space, and I want to really mihi to Auckland Council in general for the proactive stance that I can see that we are taking here through this partnership. Mauri ora.
Tēnā koe, Sala. Thank you so much. I'm going to open it up as we normally do, if that's okay with you, just for some questions to you. So I'm going to open that up, but before I do, I just wanted to sort of see if Matua Kake, if you wanted to move the recommendation.
Tautoko.
Aye, and then I'm looking at even Councillor Henderson or anybody else want to second the public input with the CEO.
Would be delighted. Thank you, Chair.
Thank you, Councillor Henderson. So it's on the table. Now I've got a pātai from Tony Kake. Matua, pātai for Sala.
Tuatahi, tēnei te mihi atu kia koe Sela, ngā mihi atu kia koe mo tā mahi hohonu kia mātou, ki te oranga hei hāpai hei oranga tā mātou whānau. So just greetings to you and thank you for the work that you're doing. Really pleased to hear the partnership with Auckland Council. I sit in this forum with my Independent Māori Statutory Board hat on. And also just want to, I guess my key question, Sela, is the smoking is the driver of health inequities, or so it is believed, but I actually think it's the other way around. The inequity is the driver for smoking. So my question is, do you agree with that? And second question to that is what do you see the role of the new Māori Health Authority in this space? Kia ora.
Kia ora, Tony. Ngā mihi nui ki a koe, and to the whānau out at Papakura Marae, you're doing amazing stuff, so thank you, Tony. Yes, so there's a number of different social determinants that we know are existent within our communities and therefore drive or continue to drive the dependence on tobacco addiction. And so I think that there's a number of things that need to be addressed in order for us to actually achieve a smoke-free Aotearoa by 2025 for those priority populations. If we take a step back and think about the deprivation that currently sits across our communities in the wider Auckland region, and also I think overlaying that now with the impacts of COVID and the sustained periods of time in which our whānau are in absolute need, is not going to necessarily help us in any way, shape or form to reduce inequities or to address some of those systematic barriers. But what it does put to the forefront is that we need to have prevention of any health issue at the forefront, and I think that a public health approach to any disease or disorder or addiction is integral for us to get to raise up the holder or the well-being of those communities most in need. So yeah, that I could go on forever and a day about that. And secondly, I think that there is a true, sorry, my baby wants to come and present to the council too. I think that there is an absolute need for us to also understand the entrenched dependence on, from a stress perspective, how do we ensure that we are reducing all of those relevant issues that our whānau are facing on a day-to-day basis. And I think that some of the initiatives that we can look at driving out through this partnership are going to be key, because what we're doing is we're co-designing with community, with whānau, with those most impacted to actually create their own solutions. I think also if we look at a broader systematic approach with regards to some of the national priorities, so we provide direct guidance and support and direction to the Ministry of Health Tobacco Control team, who will be presenting the recommendations for a smoke-free action plan for the whole of New Zealand through Cabinet in the next, I think, 8 weeks. And so if we think about some of the real key public health measures that need to be taken, if we think about the saturation of tobacco outlets, of alcohol outlets, of gambling outlets, they're all in those priority areas that we have, really honed in on in this partnership. And so if we think about some of the built environment situations that we currently have, I think supply reduction of tobacco or the availability of tobacco is really integral, and also increasing the overall well-being and building those communities to be well thriving environments so that people are proud of where they live, proud of where they play, proud of where they work, and all of those things. So there's a number of different structural considerations from a public health perspective that we should be making. I think that what is really critical to this partnership is that we have the opportunity as a partnership between a iwi and Mātāwaka owned organisation to determine and drive out from a local government perspective some really key country leading approaches, and we've already been able to demonstrate that over the duration of this current partnership. I think that's going to be strengthened even more as we move into a space where Minister Verrill is going to drive out an action plan. If we can adopt some of those approaches that are going to come through those recommendations and through the House, I think is going to be critical for us to continue to reduce the inequities that currently exist in smoking rates. Kia ora.
Yeah, subsequent comment, Mr. Chair.
I'll get the pātai out of the way first, Matua, if that's okay. And I will come back to you. Pātai, Matua Glenn.
Kia ora, e tautoko anau i te mihi a tauni ki a koe e Sala. E mihi ana ki a koe mo tamahi ki ngā whānau Māori, ki te whānau Kāpori, e mahi ana i roto i tēnei kaupapa o te auahi koe. What I'd like to ask is, and it may not be just for you to answer, but I see the targeted areas and I'm quite supportive of that. I am supportive of that. What I am asking, but is, so are we doing anything in anywhere else, such as, and I've got my list here, Helensville, Waiuku, Wellsford and Warkworth, and Pukekohe?
Not as part of this initiative, but in the broader sense, absolutely. So we're not discluding or not excluding any demographical part of Auckland in the response to a Smoke Free 2025. We're actually working really close with Te Haoranga as an organisation and collectively as in this partnership, and also as an organisation with Hāpai Te Hauora. One of the unique things that we have is also a partnership approach with the Auckland Waitemata DHBs. And so we have an initiative that we are driving out targeted stop smoking services that would reach into that catchment. So to answer your question, Glenn, we're not forgetting about the confines of Ngāti Whātua and more importantly, Te Rūnanga o Ngāti Whātua and the rurality that plays into the mix. So whilst not highlighted as a part of this specific partnership, they are absolutely as part of the broader piece of work considered and also being worked with respectively.
Mr. Chair, just a supplementary. So are we also working with our whānau down in Waiuku and Pukekohe?
Aroha mai, yes, we're also working in the Tainui catchment as well. So what we don't have as Hāpai Te Hauora, but maybe more broadly, there is the Counties Manukau DHB stop smoking service. They're one of the most highest performing providers of stop smoking services, and so I can't speak specifically to that because I don't have the necessary information on hand. But what I do understand is that Counties Manukau, through a number of their collective provider groups, such as Te Kaho Te Rangatahi, stretch across the boundary of Counties Manukau DHB. I'm not sure where and how the integration between Waikato DHB and the stop smoking services that they have provision for match or meet at that boundary. But I'm sure that there are many initiatives that are already in place, and we work quite closely with the providers that also deliver to those areas as well.
Kia ora.
Ka pai. Sela, I'm going to invite Councillor Cooper. She has some comments, and then I'll go to Matua Tony again for his comment, and then there's a recommendation on our screens that I will then move as input to the committee. Kia ora na. Councillor Cooper.
Kia ora, Sala. I just wanted, it's not really a question, I just wanted to acknowledge your acknowledgement and the work that you do with Te Whānau Waipareira, being in Councillor Henderson, my area out west. Just a huge amount of work that's been done on testing and immunisation, just going so well. Excellent. And also their work with smoking cessation. So, and also just, I want to also acknowledge while we're here is the loss of one of our nannies, Renata, to COVID. We haven't mentioned her, but I think that's really important in these times. But also to acknowledge the way that you've worked with the council. I mean, as you say, the only way we can reduce smoking and get to the right people is to do that in partnership and with people who are right in our communities. So I just want to acknowledge you for that. Thank you.
Tēnā koe, Councillor Cooper.
Matua kake. Tony?
Yeah, kia ora anō. Hey, yeah, just my comment is just to say I think it's not only a central government, local government, and everyone responsibility. I just, everyone that walks through the doors of our clinic at Papakura Marae will be asked that question if it's not known to us that they're a smoker. So it's everyone's responsibility. We have signage around the marae that says we're smoke-free marae. But also we acknowledge it through every one of our mihi and welcomes on the marae that the designated smoking site is that white line in the middle of the road. And I say that on purpose because, we're also confronting the same decision around if you haven't had your first or second vaccination, you probably won't be welcome at our marae. It's that kind of hardening up of the circumstances, I think, that we need to go to. Kia ora.
Kia ora, Tony, and I know that many marae up and down the country have for many years now, been leading in regards to having those policies in the middle of the road out the front of the marae or in the next suburb is usually where we get directed, where smokers get directed. I think also what that plays into is demonstrating how Māori and how Māori environments try their absolute hardest to ensure that we put the health and well-being of our whānau first and foremost. I think one of the real critical things here is the denormalisation of tobacco within our communities. And so if we can look at strategies from a whole of system approach, whether that be the significant reduction in supply of tobacco, we're going to hopefully then be able to spur a whole generation of people who don't even start smoking. And I think for many current smokers who aren't able to quit or are really struggling in their quit journey, what we've heard from them up and down the country through the consultation process around the smoke-free action plan is that they absolutely don't want smoking to be a part of their mokopuna's future. And so if we can have that in mind all the time and create the systems and structures and policies that match that end goal, then we're all going to be into a winning solution.
Bye-bye.
Councillor Bartley.
Oh, thank you, Mr. Chair. I just wanted to acknowledge Sala and the team at Aoahi Kore Hapori Whanui. And also, some of the team that I've seen on the ground, Rebecca and Leitu. Just really good to see your work at the grassroots. When I've been at anything in my community, I've seen the no smoking, I've seen the support that is given and the connection with council, the messages that are out there, trying to work with the touch teams and, our people where we are on the ground. So I think that's really good, and I just wanted to acknowledge that.
Thank you, Councillor Bartley, and I absolutely would be nowhere without the team alongside me, and I think that the members of our broader team that you've mentioned today are very immersed in and understand our communities so well that we can just position initiatives like this within those community settings, not creating something new, not recreating the wheel. The wheel's already there and it's already turning. How do we enhance those opportunities to really engage meaningfully and truthfully with our whānau and communities? Kia ora.
If there's no further comments, I just have one last parting apologies, I think, Sela, is one, firstly, the pronunciation of your name. My humble apologies, and also I got a text saying that I should put my camera off when I'm on the phone. I was actually on the phone to my first cousin, Gayleen Te Hore, in Blenheim. So she passes on her aroha to you. But also she said, please tell her that we are so proud of her. So look, I'm passing on those messages, and that's my humble apologies again for being on the phone while I was on the camera, but I just needed to pass that on to you. So again, ngā mihi ki a koe, and thank you so much for the mahi that you have done with the kaunihera. Kia ora nā, Sela.
Tēnā koe.
So look, it's been moved and seconded to thank the CEO and Sela. So I'm going to put that recommendation. All those in favour?
Aye.
Aye. Against? Carried. We'll now go back to item 12, just a dozen. So we'll just go back to the item. Ben,